This meeting is being recorded.
Greetings and welcome to Mount Olympus. I am Hercules Invictus, and today on the second episode of Community Wellness, I am honored to be interviewing Julie DeSimone, LSW, who is the Program Officer of the Mayor's Wellness Campaign for the New Jersey Healthcare Quality Institute. Greetings and welcome, Julie.
Thank you so much for having me.
I'm honored that you're here. And can you please give us an overview of the New Jersey Healthcare Quality Institute, its history and its mission?
Sure, absolutely. So we're actually celebrating our 25th year this year, so we're excited about that. The New Jersey Healthcare Quality Institute is the only independent, nonprofit, nonpartisan, multi-stakeholder advocate for healthcare quality, safety, and affordability in New Jersey.
Wow, that is awesome. You said multi-state. Does it exist in other states as well?
Oh no, sorry, multi-stakeholder. So we have
sorry,
membership from throughout the state, and we really cover a full lens of all of the healthcare and health policy folks throughout the state.
And it's been around for a quarter of a century now. Wow, that's a
right, yeah.
Amount of time. And what is the mission of the Quality
So
Institute?
our mission is to provide, quality, affordability, and safety of healthcare for all New Jersey residents, and we do that through about 4 areas of programs.
And what are those programs? The program areas?
So one of our main areas of focus is policy, state, healthcare policy through our Medicaid Policy Center, and we're working with the state directly to promote the delivery of quality healthcare services to New Jersey's most vulnerable populations. One of our other areas of work, go ahead.
No, go ahead.
One of our other areas is quality improvement. And so this includes a partnership with the Leapfrog Patient Group. And the Leapfrog Patient Safety Initiative is a voluntary program where we work with hospitals to improve the safety and quality of America's healthcare system. And so the Quality Institute is actually the Leapfrog Group's regional leader for both New York and New Jersey. Our third area is education. And so the Quality Institute really tries to serve as a resource to our members and the community. We provide training and informational resources on a variety of topics. We try to stay current on those topics. Just some examples, obviously in the last year, we focused on telehealth, the pandemic in general, vaccination, also vaping, mental health, the opioid crisis, and chronic disease self-management. So we're always looking to help both our members and communities members to, further their education. And then the final area of work is what we're really here to talk about today, which is our community health initiatives. One of those being the Mayor's Wellness Campaign, which, if folks don't know, that is our statewide community health initiative, where we provide evidence-based tools and strategies for mayors and community leaders to improve the overall health in their communities. And then as part of our Mayor's Wellness Campaign, we also have our Conversation of Your Life program, or a COIL program. And this is a community-based program that focuses on education around advanced care planning for New Jersey's population.
That is impressive. And I'm honored to have been part of the Mayor's Wellness Campaign since I returned to Tenafly in 2014.
Yeah, we're lucky to have you.
Oh, thank you. How did the Mayor's Wellness Campaign is celebrating its 15th anniversary?
We are.
And how did it come about? How did the idea come about?
Yeah, so like you said, we've been around for 15 years, and the program was really originated as a result of the rising obesity rates in the state. And we created the program in partnership with the New Jersey State League of Municipalities to promote physical activity, healthy eating, and just overall health and wellness throughout the state.
And how many mayors are involved in the Mayor's Wellness Campaign?
Yeah, so we currently have 422
wow.
Towns who participate in the Mayor's Wellness Campaign throughout the state.
I know here locally, aside from Tenafly, there are some other towns in Bergen County that are participating. I was invited to a meeting for one of them and shared what we're doing in Tenafly, and they seem very enthused with being a part of it as well.
Bergen is definitely. Oh, sorry. Yeah, I was just going to say Bergen is definitely one of our most active community counties in the state.
How has it evolved over the past 15 years?
That's a really good question. like I mentioned, it's really started as a physical health program. Again, as a result of those rising obesity rates. And we certainly still focus on that. Lots of our towns are running physical education programs. They're providing nutrition classes or information, but we've really encouraged towns to expand how they think of health and to, look at health through a broad lens. So, there's a few different ways that we've done that. In 2007, we started the Healthy Town Designation, which is something that we still run today. So this is an annual designation where towns are encouraged to apply to be awarded either our Healthy Town Designation, a Healthy Town to Watch, or a Healthy Town Up and Coming. And this is a application process that really encourages them, again, to think about health broadly, to look at health in different sectors throughout their communities, to think about social determinants of health. So that's something that we added to the program, after it was already created. The Conversation of Your Life program, the COIL program, is another piece that was added on in 2014. So that really expanded to older adults, but also, all residents. It's never too early to start thinking about that advanced care planning. And so that's something that we encourage towns to do as well. Over the years, we've also partnered with specific communities to provide chronic disease management programming, again, nutrition classes, and it really just depends on what communities are looking at their local level as far as their needs, and we're here to support those changes.
And every community is unique, so I'm sure that the communities have come up with the unique ways of being part of the program.
Yeah, and I always say, it really is one of my favorite things about the program is that we really want the program to be flexible. We know that New Jersey is such a diverse state and no two communities are alike. It's not going to ever be a one size fits all that's going to work in towns. So we're not here to prescribe to communities what they should be doing. We're here to provide those evidence-based tools and resources, best practices, strategies, and then we're here to hear from our community partners what's working for them, what isn't, and how we can best support them.
How did you get involved with this? You're a social worker. So what inspired you to pursue that as a career?
Yeah, so I decided to pursue social work after realizing just the diversity of options that a master's in social work would give to me. I wasn't really sure at the time exactly what area I wanted to work in, but I knew that I wanted to work with people and communities and be in a position to help and support them. In my opinion, a master's in social work is just one of the most versatile degrees. You can work in policy, you can do direct service, you can work in community-based organizations. And so that to me was really exciting when I entered the program.
And what was your journey like that brought you to the program?
Yeah, to the Mayor's Wellness Campaign specifically, yes. I started after grad school in some smaller nonprofits in Somerset County. So a lot of my experience is working with youth. I've run psychoeducational groups for children, parents, also veterans. A lot of those focused on health and wellness. And then I moved on to work with a juvenile justice diversion program, helping kids keep kids out of detention. And then also ran a mentoring program that was also a community-based mentoring program as well as a school-based mentoring program, and ran some programs as the director of school-based initiatives for a nonprofit in Somerset County. After that, I moved on to be the planning administrator for the Department of Human Services in Somerset County. And so that was a really great opportunity to kind of expand out of working solely with youth. In that role, I got to oversee the planning and program implementation for a lot of diverse populations, individuals experiencing homelessness, veterans, older adults, individuals with disabilities, and then also a community mental health center in Somerset County. At the time, when I came to the Quality Institute, which was about 2.5 years ago now, I was really looking for something that would get me back into the community, working directly with people, and was really excited about the impact that a community health program like the Mayor's Wellness Campaign could have on folks.
So how did you find out about the New Jersey Healthcare Quality Institute? How did you stumble across it?
Yeah, I just came across them in a job search.
Oh, okay. Now, in your years there with the Mayor's Wellness Campaign, what activities, what programs are you the most proud of?
You know, I'm really have been impressed by the work that's been done through this pandemic. Towns have stepped up and leveraged their partnerships and the structures that have been created around their Mayor's Wellness campaigns to really respond to those changing needs that we've all experienced in their communities. You know, it's an event-based and program and activity-based initiative. And so when the pandemic first hit and we weren't able to meet together, you know, I wasn't really sure what that was going to look like for towns. And I was just really impressed by the dedication of our local partners like yourself to continue programs moving forward. You know, some examples of what folks have done over these last 2 years, you know, as you probably know, food insecurity is something that's really drastically increased throughout the state. And not only in communities that have always experienced food insecurity, but also in communities who have not previously had this issue. So it was something they weren't necessarily ready to deal with. We saw Mayor's Wellness campaigns leveraged to host food drives, to create meal programs, to help older adults get their groceries to them because they were, you know, obviously our most vulnerable population and going out to the stores. So that was really exciting to see. Some other examples, moving programming to the virtual platform. That was something that we all had to adjust to, but we saw Mayor's Wellness campaign committees throughout the state almost immediately decide, you know, exercise classes, yoga, mindfulness, meditation, book clubs, all of these things to help keep people connected, but also to help them keep focused on their mental health and their physical health in a time where that was challenging. We also saw a lot of Mayor's Wellness campaigns decide that community connection was something that was still really important. We know the negative impacts of social isolation. I think we've all probably felt them at some point these last 2 years. But also, you know, they have these effects, especially on our most vulnerable population. So creating walls of gratitude in their community where folks could post something that they're grateful for, and they did it in a very visually accessible place so that as community members were driving by, they'd be able to see that to kind of continue a message of hope in communities. So, you know, as far as what I'm most proud of, I just really have been impressed by people's continued dedication to the program, but also to the wellness of their communities and using this program to focus on that in this time.
You've mentioned several things that sound really interesting, and I want to try now to implement them in my community.
Yeah, absolutely.
I thought we were doing a lot, but there's things we're not doing, so we should be doing them. And I'm really looking forward to trying those out. What is your larger vision for the Mayor's Wellness Campaign?
Yeah, so I think one of the things that you know, we really want to continue to support towns to focus on is just broadening their vision of what health means. We love the physical health activities. We love the 5Ks and the community events. Those are all really important and also contribute to the health and wellness of our communities. But just asking towns to really use data to support the work that they're doing. Asking them to, you know, to the extent that it's possible, do a local needs assessment. What is your specific community need? Where you may be lacking in your health world? And how can you create programming that addresses those needs? And then the second piece of that is really evaluating those programs. It's really important that towns are seeing the impact that their programs have and then being able to share that impact. It's important because we want to make sure that the programs that we're running are meaningful and are, you know, resulting in the change that we want. But it's also really helpful in a time where funding for program and activities can be challenging. And if you're able to support what your program is doing with that data to show how impactful that it is, you're going to be more successful in accessing some of that funding that might be really needed in your community.
And yes, those are all like phenomenal points. recently, there's the Healthy Town designation that you spoke of. So I've passed that information along to our mayor and the council.
Great.
So I'm waiting to hear back from them on that. Are there any
one
other?
one more week to apply. Don't miss the deadline.
I got your email. I
Okay.
saw it.
Perfect.
And I'm going to be passing that one along today too. Are there any other programs that are coming up besides the Healthy Town designation?
Yeah, so something else that I'm really excited about this year, you know, I mentioned changing needs as a result of the pandemic. One of the things that we've been able to do in these last 2 years is really collect feedback and data from our community partners. We did focus groups throughout the state. We did one set each year. We've also done a statewide survey just to get a better sense of what communities are experiencing, what are your challenges, and how can we best support you. And through that process, what we heard was that one of the main needs that towns are experiencing is support around mental health. I'm sure that won't be surprising to folks. No. Like I said, I think we've all experienced that strain in these last 2 years. And, you know, mayors and other community leaders are recognizing that they need more support in how to provide resources and support their residents and their needs. So hearing that feedback, we were able to secure funding from the Horizon Foundation for New Jersey to launch a mental health initiative. So we were really excited to launch that initiative back in June. And so as part of that, we have offered 3 mental health first aid trainings to our community partners. And so mental health first aid is a program where you become a certified mental health first aider. It follows the model of like a CPR training class, but for your mental health. So it equips attendees with the ability to respond to somebody who's in a mental health crisis. It also talks about stigma and language and the importance of connecting folks to resources early on in their mental health challenges. So we have trained 45 community leaders in that program so far through that initiative. The other piece of that initiative is that we'll be launching a comprehensive mental health toolkit in the early spring. So this is going to provide some basic education about mental health issues that folks might be experiencing. And it's also going to give activity recommendations and evidence-based practices that towns can implement in their own communities to address mental health needs. So we're really looking forward to launching that toolkit and hope that that'll be a great resource for our community partners.
So the toolkit is coming. Is the training continuously available, or is there like a wait for classes?
Sure. So we did host the 3 that we had planned for this cycle right now, but it is something that we plan on continuing to offer. So people can definitely stay tuned. There will be more of those coming over the years.
I shared links to the activity on Facebook.
Great.
And I'm interested in myself. My background is mostly in mental health. I have like 35 years of experience working in psychiatric hospitals and nonprofit.
Oh, I didn't know that.
And so forth. Yes. So it might be a way of getting back into the field.
Yeah, it's a great. It's a great training. I can't recommend it enough. I think anyone, no matter what your role is in your community or your personal life or your professional life, I think everyone can benefit it. If you have the opportunity to take the training, you definitely should.
And this is a time of stress. It is a time of change. It is a time of uncertainty. So it's thank you for doing that. That's a very important thing. Here in Tenafly, what we've tried to do is, one, to get communication available to people in as many different ways as possible. So they have like a calling system where the mayor calls every household that's signed up and gives an update on what's going on a very regular basis.
Great.
And that same information is put in the online groups that have news. So everybody can tap into this message, or they can go to the borough website. They also have people who call folks who are older or homebound to make sure that they're okay and so forth. And personally, people do like a lot of different things. Like, for instance, I personally has started the podcast for the Tenafly Mayor's Wellness Campaign. And now I'm learning YouTube. So you're the first YouTube show we're doing. and I created a Facebook group. I ran into a setback. Somebody hacked my Facebook account.
Oh,
So I had to start over from the beginning. So it doesn't have that many people yet, but it'll get there. But I started a Facebook group for it. I also started a book and DVD giveaway. I do a different book or DVD every week. And if somebody wants it, I'll give it to them. I'll meet them in downtown Tenafly. And if not, I'll donate it to a library. In this way, support our community. And of course, sharing information. Can you think of anything else? Because I'd like to do more. Can you think of anything else I can do or my community can do?
yeah, I was going to say, it sounds like you have your hands full, which, you know, kind of leads me to one of our main recommendations, which is to, you know, consider creating that Mayor's Wellness Campaign Committee. It really is hard to do it on your own. I know you have other folks who you're working with and who support you in the work that you're doing, but we see the most success in when towns bring a multi-stakeholder group to the table. It helps to diversify the activities and programs that you're able to run. It also, you know, like yourself, most people are wearing multiple hats. A lot of the people, volunteers, staff who work with Mayor's Wellness campaigns across the state, they're doing it because they're passionate about health and wellness, and it's something that they care about. That doesn't always mean they have the capacity to do everything that they're interested in doing. So I always suggest, you know, building that team around you. It sounds like you have a lot of activities going. You know, you also brought up something that we've really had to focus on in the pandemic, which is, again, moving a lot of our activities, our communications to that virtual platform. Social media has become increasingly important. Not that we weren't already focused on that, but it's been a really significant way that towns have been able to get their information out to residents, especially to kind of combat that isolation piece. So it sounds like you guys have a lot of great programs up and running. I would say, you know, as we hopefully continue to move towards being able to have those community events and education opportunities, you know, use your local data, use your local partners to figure out, you know, what do we need in our community and how can we address it through the program?
Because we cover health on my podcasts and my other events, I have folks who are like in Sussex County, and one of them has a podcast called The Sussex Report. Another one has a podcast called Eye on Northern New Jersey. So they've agreed to focus on the Mayor's Wellness campaigns in their area.
Great.
So they have monthly shows. So if we could work out a way where mayors who are interested in being interviewed, or committees that are interested, or individuals that are interested in being interviewed, they can contact them. I'll gladly give you the information. And also in Southern Jersey, I believe Monmouth County, I have one of our hosts living there. She's the women's empowerment psychologist and positive therapist, Dr. Barbara Becker-Holstein. So she was interested in being like the podcast person in that area. So we're trying to spread it beyond Tenafly and become active, have folks become active in their communities throughout New Jersey, because it's an excellent program and it does an excellent service.
Thank you. We really appreciate, you know, all of your support and the work you do to get the word out. And we'd be happy to support any of those other communities who are looking for speakers or just connections to the people in their communities.
Thank you so very much. How can folks get involved? Like I found out about it from our previous mayor, Peter Rustin. So that's how I found out about it. And we had a sign in our community that Tenafly is a healthy town, you know, designated a healthy town. So I was curious about that, and that's how the conversation came up. How can folks who are excited by what you spoke of, how can they learn more? How can they get involved and hook into the Mayor's Wellness Campaign or the other programs you mentioned?
Sure. So they can always visit our website, which is njhcqi.org. That's going to have a list of all of our communities that we work with. It's going to have a list of all of those Healthy Town winners over the years. So that's a good way to kind of see if their community is active. They can also contact me and I can let them know if their community does have an active Mayor's Wellness Campaign committee and get them connected to the folks who are working on that in their town, or help them to get one started. You know, we obviously like to start with our mayors and have them sign the pledge and commit to the program. But oftentimes, like you mentioned, these programs are driven by residents who are interested in bringing this type of work to their community. So, you know, they can email me at, do you want me to say my email?
If you'd like, sure.
Okay.
I'm going to include it in the description on YouTube.
Perfect. Great.
So I'll put it there too.
Yeah. So it's J DeSimone, DeSimone at njhcqi.org. And so, yeah, reach out. We'll get you connected to the people in your community who are already working on this, or talk about how to help you get started.
We've covered a lot, and thank you so much for your time. And it was a lot that we covered. Is there anything that we left out that you can think of to add?
No, I just want to thank you again for having me and for, you know, hosting this platform to get the word out about all the important work that you're doing, but also that other folks throughout the state are doing. So thank you for having me.
And thank you. You're awesome, Julie. You've been, I know all my interactions with you have been incredible and very helpful. So thank you again for being our first guest on the YouTube show. And I look forward to speaking with you again very soon.
Thank you.
And thanks to everybody who's watching this on YouTube. Until next time, this is us wishing you joyous journeys and amazing adventures. Take care. This is Hercules Invictus.